Dr. Ho. Mabel was my doctoral student, so I'm extremely proud of her incredible accomplishments. She brings a really strong background with more than 20 years of direct practice experience in community gerontological services. And she has this passion about how to know more about how to age successfully in Canada. Has done quite a few really interesting papers which have gained a great deal of international media attention. And so we're absolutely delighted to have you all here today. And Mabel, the floor is yours.
Thank you, Professor, and thank you everyone for coming today. My name is Mabel, and I'm a Professor Fuller Thompson student. And I'm very fortunate to be her student and learn so much during the process. So this webinar is about successful aging in Canada. Findings from the Canadian longitudinal study on aging is also my doctoral thesis. So perhaps I will start by telling you a bit about myself. I'm a social worker by training. I've been working in gerontological social work for over 20 years. I work with stroke survivors and people living with dementia and other chronic diseases. So for the longest time, I thought providing care and support to older adults is more about disease-specific care. But then with time, I noticed that we can provide the best care to older adults. But what if we can do more? We can encourage and support people to live well and age well. So that's why I look into this topic about successful aging. So some of the backgrounds about this topic is that successful aging is generally understood as aging well is a worldwide aim for many people, for older adults, for practitioners, for researchers, for policymakers, and it's one of the ultimate goals of gerontology. It's actually quite interesting that when we look into the literatures about successful aging, there are two foci. So one is the researchers' defined definition of successful aging that classified about 1/3 of older adults as successful ages. But when we ask middle-aged people or older adults about themselves and how they're doing, over 90% of them will tell us that they're actually doing quite well. And the fact is, many older Canadians are living with chronic conditions as well as some forms of disabilities. And there are also not too many studies on a topic in Canada. So that's why we want to look into this. In preparing for this study, we actually looked into different theoretical perspectives on aging well, like active aging, healthy aging, optimal aging. And the reason why successful aging was chosen for a few reasons. First of all, is it has a relatively long history. Since the 60s, people have been talking about successful aging, what it is, and how to define it. And I believe the conversation is still on. And it's still the most dominant as well as frequently referred concept of aging well. And it also provides a broader understanding of aging by covering the physiological, psychological, and social aspect of aging. So this study was guided by a synthesized conceptual framework composed of 3 theoretical perspectives. Bonfabini's ecological system theories, Young's and colleagues, multi-dimensional model of successful aging, and Keir's concept of complete mental health. So we are going to look into the interpersonal, intrapersonal factors, as well as the other factors surrounding the individuals to understand successful aging. So we look into the literatures and notice that there are different definitions of successful aging. And we know that there are the researcher-defined definition as well as the lay perspective on successful aging. So that's why we try to combine them together to create this expanded definition of successful aging. It is about having no limitations in activities of daily living, as well as instrumental activities of daily living, regardless of the number of chronic illnesses present. and freedom from any serious mental illness, memory problems, and disabling chronic pain, as well as the presence of social support. And the last part is actually quite interesting. That is about the self-reported happiness and subjective perceptions of their physical health, mental health, as well as aging process as good. So in terms of the measure of successful aging is actually 4 domains as mentioned. So we look into the data set, which is the Canadian Longitudinal Study on Aging, and we look into questions related to this. So for the physical wellness, we look into questions related to activities of daily living, as in the ability to dress and undress oneself without help, the ability to eat without help, the ability to walk without help, or with some help from a person or with the use of a walking aid, as well as getting in and out of bed without help or aids. For the instrumental activities of daily living, we look into the ability to use telephone without help, to get to places or walking distance without help, going shopping for grocery and clothing, preparing meals without help, doing housework with help or without help, as well as taking medication without help and handling money without help. So for the disabling pain, we look into whether the person has any pain or discomfort that will prevent them from doing their activity of daily livings. And for mental disorder, we look into anxiety, depressions, as well as PTSD, and not having a diagnosis of memory problems. And in terms of the mood, we look into whether the person is feeling not having low mood, as in feeling depressed or did not feel happy or feel satisfied with life all the time. For social support, we ask people if they have someone to care about them or to provide support to them when they're in crisis, as well as the lack of a self-rated wellness in terms of their physical health and psychological health. So if they answer no to all these questions, they will be classified as successful agers. If not, then they will be considered as the typical agers. So for the baseline factors, we look into different things. It's a 3 papers dissertation. So we look into 3 main factors, the immigrant status, marital trajectory, as well as social participation. And then for the demographics, we look into the age, sex, and for education factors, we look into the educational level, and lifestyle and BMI. We look into some of the modifiable lifestyle factors, as in whether the person do exercise and what kind of exercise, whether they have sleep problems, and so on. And also if they have some of the physical disabilities, like heart disease, diabetes. And then we also look into the financial well-being of the person. And all these definitions can be found in our first paper. So when we use the new definition, this expanded definition of successful aging, to see how many people are actually doing well. And we noticed that the prevalence of successful aging at time 2 in the data set was about 70%, and that is more than 7 in 10 of those who rate the aging process as good to excellent were identified as successful agers. And the new definition has brought the gap of success of researchers' defined definition of successful aging, as well as the lay perspective of successful aging closer. So it's a more balanced definition of successful aging. So for the study population, we used the Canadian Longitudinal Study on Aging to do the study, particularly the first 2 waves, which is the baseline as well as the follow-up 1 data, and we call that the time 2 data. So in the data set, there are about 30,000 people, and then about 27,000 people participate in time 2, and about 18,000 people reach the age of 60 years or older at time 2, and then, but not all of them are doing well or aging successfully at baseline. And also some people, they have missing data. So the final sample was about 7,600 respondents in the 3 papers that they are defined as aging successfully at baseline and were 60 years or older at time 2. So we use SPSS version 28 to do all the analysis. As mentioned, we use the first 2 waves of the data from the comprehensive cohort of the CLSA to do the analysis. Bivariant and multivariable binary logistic regression analysis were used. So it's a 3-paper dissertation. It's actually quite interesting that the first one, we focus on the immigrant status. So we look into the association between immigrant status as well as successful agings. And the second paper, we focus on the marital trajectory. And the third one is about social participation. The first and the third paper were published in a special issue of the International Journal of Environmental Research and Public Health. So for the first paper, it's about immigrant status and successful aging. We know that there are not many studies looking into the association between immigrant status and successful aging. So that's why we want to learn more about it, to see if there is any difference between the Canadian-born as well as the immigrant older adults. So these are some of the research questions we have for the first paper. So we want to see if immigrants have a greater prevalence as well as higher age, sex adjusted odds of successful aging than Canadian-born peers in the time 2. And what baseline factors, if there is any, attenuate the association between immigrant status and successful aging. And then we also do a study among the immigrants and to understand what baseline characteristic predict successful aging at time 2. So for the result, we noticed that Canadian-born older adults had a slightly higher prevalence of aging successfully at time 2 than their immigrants counterparts. And Canadian-born older adults had approximately about 24% higher odds compared to immigrants of aging successfully after we have adjusted for about 20 factors. So for the discussions, we know that immigrants, older adults, had a lower prevalence of successful aging than their Canadian peers, Canadian-born peers, and future research on how we can better support older adults, particularly immigrant older adults, as well as Canadian-born older adults. Would there be any policies or intervention that we can support them? Whether it's about promoting a healthy lifestyle would enhance older adult achieve successful aging in later life. So we do think that culturally and linguistically appropriate programs and services, such as acculturation programs, financial aid, language programs, information and referral services, may benefit immigrant older adults to age well. So that's paper 1 in a nutshell, and paper 2 was about marital trajectory. We know that the family structures actually change with time, but we don't see a lot of papers on the association between marital status, including the trajectories of marital status on successful aging among older men and women. So that's why we want to look into this. So for the research question, we look into how the trajectories of marital status associate with successful aging at time 2. And we adjust about 21 baseline factors. And would they, if any, attenuate the association between marital status and successful aging? And are there any sex differences in the relationship between marital trajectory and successful aging at time 2? and which trajectories of marital status are associated with successful aging at time 2 for males and females. So in this analysis, we know that the prevalence of successful aging at time 2 among males and females was similar. The adjusted odds of successful aging was slightly higher among those who were continuously married or became married between the two waves. And the adjusted odds of successful aging was significantly higher in females than in males. We also look into the analysis to see if there is any difference by sex, and there is. So that's why we also do the analysis by sex and look into some of the differences. So for the male respondent, we know that there is significant positive association between marital status and successful aging, particularly for those who are continuously married, continuously widowed, or became married since baseline when compared to the never married peers. So as you can see from the graph, that the red circles were the findings that we noticed. And for the female respondents, we know that there were no significant differences with respect to successful aging between never married individuals and any of the other marital categories, with the exception that those who transition from married to not married between the two waves. So that's the green circle on the graph. So in comparison to the never married older adults, we know that the odds of successful agings were higher for respondents who were continuously married or became married after the baseline interview. And there was also an association between trajectory of marital status and successful aging differ significantly by sex. So for the implication, we suggest that supporting older adults, especially those who have experienced widowhood, divorce, or separation in later life, in connecting with others or developing that social network may be helpful. And future research is needed to understand the rationale between this, behind this observed association. So the third paper was about social participation and successful aging. Again, we do not see a lot of papers on social participation. That's why we also look into this aspect. So for the 6 social activities that were that we study were the church religious activities, educational or cultural activities, service club or related activities, neighborhood, community, or professional association activities, volunteers or charity work, and the last one was about recreational activities. And the research questions we had were about, do those who participate in social activities at baseline have a higher prevalence of successful aging at time 2? And do they have like a higher age sex adjusted odds of successful aging at time 2? And after we have adjusted for 22 baseline characteristics, if any of those attenuate the association between social participations and successful aging. So the analysis, we noticed that the prevalence of successful aging at time 2 was significantly higher in respondents who at baseline participate in these 4 activities, which is the educational or cultural activities, neighborhood, community, or professional association activities, volunteer or charity work, and the last one was recreational activities involving other people. So we do know that the key is about involving other people, where they will have the opportunities to engage and to connect with other people. So, and in comparison to those who did not participate in these activities, the odds of successful aging was significantly higher among older adults who at baseline participate in volunteer or charity work, as well as recreational activities. So as you can see on the diagram, the red circle, so they're doing significantly better than those who did not participate in these activities. So it's good to see that older adults who participate in volunteer or charity work and recreational activities were more likely to achieve successful aging than their counterparts who did not engage in these activities. So it is possible that there have been lots of suggestions as well as papers about social prescribing. Perhaps social prescribing in volunteer opportunities and recreational programs may help support older adults' health and well-being. But definitely we need to have more study and research to look into how this intervention and how that will support people to age well and to live well. So to summarize, the present study look into three different relationships, the immigrant status, the marital trajectory, as well as the social participation. So we know that the respondent had higher odds of successful aging if they were Canadian-born versus their immigrants, and if they were continuously married or newly married or got married between the two waves versus those who were never married. And the last paper, we know that people who engage in volunteer or charity work, as well as recreational activities, seems to do better than those who did not engage in these activities. And we also notice that there are some significant baseline factors associated with successful aging. So in the three papers, we know that there are some factors may not be easily changed, but there are definitely modifiable lifestyle factors that perhaps we can work on. Those factors include being younger, having higher income, being married, and not being obese, and have a normal or a healthy body weight, and then engage in some forms of physical activities, because we do know that a lot of people are, more than 80% of Canadians, older adults, are physically inactive. So doing exercise definitely help. And not having sleeping problems and being free from heart disease or arthritis. And particularly in paper 2 and 3, we know that the female sex was also one of the significant baseline factors, and also not being socially isolated, particularly in paper 2. So if we are not isolated and we connected with other people, that may help with our aging well as well. And the last one is about not smoking. So particularly never smoking or not currently smoking. So that came through in all the three papers. So it's never too late to quit smoking. And there are some limitations of the study. First of all, is the study is constrained by the variables available in a data set. We can only use what is available in the data set. And if there are questions that we can look into, perhaps we can have more understanding about successful aging. And the second point was about the disproportionately post-secondary educated respondent. In the data set, there was about 80%, but in the populations, there was about 45%. So it is a little bit disproportional. And interviews in the CLSA were conducted in English and French. So the sample restricted to immigrants with official language skills. And also few responsible, visible minority members in the sample. So in the data set, there was about 3.6%, but in the populations, there was about 8.1%. So when I was doing the study, only the first two waves of the study were available. So we cannot really examine the cohort effects, but with more waves of data become available, we can learn so much in the data set. And also the short span from baseline to time 2, when we study the marital trajectories, is a relatively short period of time, 3 to 4 years, so that we might not be able to explain too much about successful aging. And also the observational nature of a study really can determine causality. And there are some missing data as well. Cases with missing data is with about 900 plus. And we also exclude that in the study. So for the implication, we do think that culturally and linguistically appropriate programs and services may be helpful to particularly immigrant older adults. And we notice that there are quite a lot of modifiable lifestyle factors, and perhaps we can work on those, as in like exercise and trying to find ways to sleep better, and so on. So the active and healthy lifestyle could be something that we can work on. And also the prevention of chronic diseases and physical disabilities. We know that for some of those conditions, that will affect the quality of life of older adults, and how we can prevent that or better manage that. And also the promotions of positive mentality and social connections. So as to how we can connect with others and try not to be isolated. And whether these research as well as the policies and interventions will be able to, how we can better support older adults to live well and age well, we would like to learn more about that. So for the future research study, we hope that we'll be able to learn more about the experiences and needs of older visible minority immigrants and older adults who are never married, and those who are widowed, divorced, or separated. If there is any programs or services that we can better support them. And also we have talks about social prescribing. So what about the long-term benefit of social prescribing, and how we can use that, how that will be able to support people.
Native, like white Canadians donate as well.
And the other one is quite interesting is actually, I call that paper number 4 that I've been working on, is the experiences of the resilience of the adults. Because when we are doing the analysis, we know that some people actually, they might not be successful agers at baseline, but they actually improve over time. So we were wondering, so why so special, and what happened to these people? So we do hope that we'll be able to learn more from their characteristics as well as experiences, so that we can support more people to age well as well as to live well. And the last one is the modifiable lifestyle and health-related factors. So perhaps there are so many things we can. It's easier said than done, but if there is anything we can do more, we can just support. We can provide that environment to older adults, so that we'll be able to work on this together. So those would be something that we really want to look into in the future. So to conclude, the study provides an expanded definitions of successful aging. It brings the gap of the researchers' defined definitions of successful aging as well as lay perspective of successful aging closer. So we know that about 70% of older adults who rate themselves as aging well to excellent were actually doing successful ages based on the expanded definition. And the 3 papers also provide more understanding of successful aging in terms of how the immigrant status, marital trajectory, and social participations are related to successful aging. We need to have the policy and interventions to support older adults, and definitely we need to learn more about that. So for future research directions, I think it's ongoing. And I'm quite sure that we will learn, and especially with the more numbers of data set become available, we'll be able to learn more from the data set. I noticed that there are quite a lot of comments on the chats. So perhaps we can look into it and we can have some sharing. But I really want to thank my thesis supervisor, Professor Esme Fuller-Thompson, for teaching, guidance, support, and inspiration during the entire study, as well as my committee members, Dr. David Burns, Dr. Eleanor Poriagam, as well as all the wonderful teachers and people that I have worked with during my studies. I have learned so much in the past many years, and I look forward to learning more with you all. So I also have the references at the end. So perhaps I will stop sharing here to see if we can have some sharing together.